I want to put things in perspective by talking about this dark blue line. This represents the 7-day rolling average of new coronavirus cases in Santa Clara County. By mid-October, it was hovering around 100 cases or so per day. To give you some idea of just how bad things have gotten, 2.5 months later, by the end of December, that number shot up to well over 10 times what it once was. That has resulted in 10 times more COVID patients in hospitals, now up to 100 new patients a day, and 10 times more people going into ICUs per day. Deaths have nearly quadrupled.
The realities that could happen are almost too horrible to contemplate.
Dr. Ahmad Kamal, the county's director of healthcare preparedness, said the South Bay's healthcare system is near the breaking point.
Where we are now is a terrible place, but what I dread is how much worse it can get if we fail to turn this around right now.
Daniel Franklin is the EMS duty chief and tracks ambulance wait times for the ER. In November, paramedics had to hold patients for 31 minutes at Valley Med. In December, it was a 55-minute wait for the ER. Franklin says people who try to use the ambulance to bypass the waiting room better think again.
There's also a common misconception that if you go to the emergency room by ambulance that you're going to get seen quicker. And I want to dispel that because that's not the case. So some of our patients we've been bringing in by ambulance have gone out to the waiting room.
Dr. Jeff Chen runs the ER and says the staff are physically and emotionally drained.
The ER is full. Folks are waiting for beds. I'm begging everyone to help us out here because we're not the front line. We're the last line. We need everyone's support so that we can continue fighting for and with everyone here.